different tastes what we are going
Yeah.
to have.
Okay.
But that is not available for others.
Okay. So then instead
Right?
of
Yes,
yeah.
right.
Okay, and we shall be distributing these documents in due course of time. So this is just a plan, like how should we approach for the data from the initial part of the study. I think. Thank
Thank
you,
you, sir.
Dipshika.
Thank you.
For the day. Uh, so in this, we are just trying to plan like how should we maintain a good communication between the sites and the data management teams and the central coordinating teams by RAC and CDSA. So these slides are basically focusing on that. So already Dr. Komal has shared about their plan, the CDSA, how they are planning. So similarly, Incline has also has some view on that, and we will be open to have your comments on that. So I will just quickly take you through these slides, and I just want your feedbacks, like how should we plan the communications and how frequently the investigator should meet in order to have a complete track of the progress of the study, and if any problems are being faced by any site, so that can be resolved immediately. So yeah, so I will just take you through these slides. This will be the whole leadership plan, like the central coordinating team, data management team, investigators, and the site level data management teams. Then about like the responsibilities of at each level, the data collection at the field level will be the responsibility of field level data collection team. The data management at the site level will be of site investigators as well as the site data managers, so they will closely look after all these things. Then at the central level, the network coordination coordinators and the central data managers will look, and once it passes all through all these levels, then the data will be finally logged, and we can have the final clean set of the data. The second thing about these 7 step quality assurance, like we will ensure that there will be a protocol finalization meeting, which is presently we are in trainings, that site level quality assurance, site visits, data monitoring and quality check at site and the central data management center, monthly review meetings, and project management and advisory group. So like BIREC generally organize the SAG meetings, and that is quite means like enlightening for us, because their suggestions help us to improve and take the decisions which are going wrong. So these are the 7 step plan which is proposed, and just a few about these workshops and plans, like the series of pre-protocol workshop to identify the way forward, bringing on board a multidisciplinary team of experts, harmonization of tools and techniques, documentation, detailed and summary version of minutes, development of SOPs, instruments, bilingual, pre-tested and piloted. The second thing is about the training of the staff, potential staff sensitization on project objectives, module-based centralized training of all data collectors, annual refresher training and certification. The site level quality assurance, identifying existing quality assurance processes, SOPs, careful and unbiased selection of project staff, close oversight by the site PI and co-PIs, close oversight of data quality, data checked with fixed periodicity for completeness and accuracy before transmission to central database. Site visits, scheduled and unscheduled visits can be planned by the central coordinating team, direct observation of data collection processes for ensuring protocol adherence, use of checklists for site visits, briefing and debriefing with the site teams and troubleshooting, data monitoring and quality check like paperless data collection, real-time access to data, monitoring team in contact with the sites on monthly basis. Logs has to be maintained, and the sites can also maintain the weekly logs of the progress of the study, so which can be discussed during the monthly meeting with the sites, so that a clarity will be there, like how the study is progressing and what are the challenges the sites are facing in terms of data. Monthly review meetings, monthly teleconferences, Skype meetings between the sites and the central data management team, investigators from the site, and network coordinating teams. So it can include BIRAC, CDSA, Inclin. They will be a part of that teams, and also the sites will be there, so that if any challenges are coming up, so we can discuss during the monthly review meeting. So these challenges could be identified by the site or could be identified at the central team, so that they can be discussed during these calls. Separate call for each site for feedback and troubleshooting. Project management and advisory group, which will monitor the study progress, provide overall guidance, and guidance on future expansion and fund generation, so that can be provided. Uh, So just to summarize, that the field level, the site data managers have their role for the field level data collection. The central level data manager, which is placed at Inclin in the study. So he will look after the all the data from all the sites, and then finally the data logging. Next is it's about the data cleaning and completion. So this is just a plan, and we can have a discussion on that. Like for example, we shall be doing the recruitment of 750 individuals, maybe in a span of 15 days. So if we complete 750 individual recruitment in 15 days, so that data has to be finalized by the site in 30 days, next 30 days. So once they close their data at the site level, then that data will be transferred to the central data manager, who will evaluate based on his specific monitoring points, and he will just see, and then we will have a call between the site and the central team, and thus after that discussion the data can be logged. So this is a brief plan, and I will just stop for the baseline and look for your comments on that. Is it means like shall we do in this way, or if there is any other plan or anything, any suggestions from the sites? Yes, sir.
So this site level data log, I mean, all the data is anyway entered onto the portal. So everything is actually centrally available from the time we start the study. So is there a really a role for that site level data log, or is there a provision for us to actually make changes to the data till we log, after which only the center can do something?
Yes, sir. Sir, also the Neeraj can answer, but just to clarify that though the data will be means like entered into the EDC platform, and it is with the Inclin, but Inclin will not work on that data. It will be directly shared with the site, and site will have access to that data. They can modify the data, but with all documentation will be taking place. And once the site will confirm that our process is done, we are done with our cleaning process, everything is done, and once they close it, then only the central data manager will look after that data, and then they can start raising the queries from the central site. But previously site should means like will be encouraged to look at their data and try to clean it up first, and then the central data manager team will come. Neeraj, would you like to add something?
Hello, yeah. So I think this will be like the best person will be the sites only to clean the data. So you are like aware of what is going on the field, and we can just support you in all that. Okay.
30 days is fine with us.
Yeah.
I think that is feasible for all sites.
Yeah, yeah. So in case we are facing trouble, then we'll raise Jira and then you will take over.
Yeah,
Right?
exactly.
Yeah.
Yeah,
Whatever
but
whatever editing is available at site level, this 30 days is sufficient for
30 days.
for baseline, right?
Yeah, for baseline. I'm going matlab step by step. So for the baseline thing.
Yes. Thank you.
Now, yeah. Any other question from other teams?
So I have a question. I think we will be able to complete the baseline like within a 2 week time or 2 months baseline. Use my even I think it will be too much. Like if we are going to recruit for 2 months, then you have to like the study will go off. Like you, the last follow will go like for another
Sir,
2 months.
we should consent each person. Definitely, a lot of consenting is involved. It will take time. It will definitely take 2 months.
Like we have a 5 cluster,
Yes.
and per day, how many cases you are going to recruit?
Not more than 5
So they will be
per-
around
per
25.
team. Per team.
Yeah, so there will be 25 cases per day.
That is ideal case scenario, sir.
I think that 2 months will be too much. I think we have completed this like zero survey.
It will affect the monitoring quality if we rush things in the baseline, because some sites are new, some sites are seasoned.
No, but I think 1 month will be an enough period to complete that. Otherwise, it will be a lot of data because after that the AFI will also start. So how the site will manage that data? 1 month is a sufficient time to look after 750 individuals and close the baseline data at least at that point, and then we can focus on the AFI data. Because in one year period we are generating that much of data, baseline, AFI surveillance, and line data. So if analysis is delayed, then it will delay for a longer period of time.
So the study will
So
like
it's
your
just
time
a
frame will be like for 14
suggestion.
weeks or
Yeah.
14 months. Then.
Yeah.
So,
So it's a suggestion that we should just, because we are hiring a specific data manager for the study. So if that data manager is there, so I think he can just highlight the challenges to the investigators, and investigators can directly look into all those problems and rectify that. But definitely we will need a system that by the end of 2 months we will close the baseline data, and let's focus on the other part.
but recruitment should be completed within a month, one month time.
Within
So
15
I
to
think
20
you need
days.
to work on that. I think. 2 months will be too much. Then you are going like
6 weeks we would need.
At least 1.5 months.
6 weeks we will need because no, like
Okay.
consider. True. Yeah.
exactly.
Abhishek,
Yeah.
so based on our previous experience and what are the resources we will be having for this study, so we will require at least 30 working days to complete the cohort.
30 working days or 30 days?
30 working days. Working days.
Because 30 working days will again take it to
That's a
1.5
regulatory person
months.
speaking.
Even
That shows the regulatory person speaking.
Hey, Dheeraj, we were thinking to complete within a 2 week time.
No, how is it possible?
Sir, it is next to impossible.
Impossible.
Yes, sir. Yeah.
all things, I think 2 weeks is not possible because you're talking about consent. It's a 2-page consent. We're talking about quality.
Yes.
So let's all agree that, we should not rush those.
Correct.
We are generating data for the country.
So
and
can
it's
we
not
come
that,
on a common
"No, hafta mein kar do, baseline
Ah.
khatam karo." I
It-
think
it-
we
it-
must
it-
agree.
it's not only
I-
consent. It's
exactly.
not only
So we
consent.
must also appreciate when certain sites have things. We will work together. I will also appreciate what.
Now, see,
But
let's
not compromise.
let's get down to there is another component like for baseline and for inline. There is going to be blood collection plus doing 2 tests, giving out the report. Now think about the time that is taken by a phlebotomist out there. It's not anywhere less than 15 to 20 minutes.
No, that's perfectly fine. I'm just saying.
No, that's
that-
not fine.
Yeah.
Because we have other
That's not
stuff.
fine. What I'm trying to tell you is in a day, a phlebotomist, like there is a field worker, the people are, and actually they are going together in the field, sort of. The phlebotomist will take at least 20 minutes to collect the blood, do the rapid test, and hand over the report. So that if you calculate that time, how many recruitments they can do?
Sir, the rapid tests are already being conducted in the site labs as discussed in the morning.
No, no,
So
no.
only the phlebotomist is only taking the
That
samples
is
in the
that,
field.
that is for AFI.
POC, we are talking about.
So in the
HB and
baseline,
sugar.
though, we are only having the POC, so that will be on the spot like a drop of blood.
It will require some time, na?
But not
Even we
20
have the
minutes.
anthropometric measurements
20.
also, na, height, weight, everything.
So means like the sites can suggest how much time they will need.
30 working days.
30 working days. So should we close at 30 working days?
30 working days is fine. Okay. No, actually, like when we were doing that.
6 weeks.
Then-
Sir, one query,
So should-
30 working
should-
days from when?
So should we close at 30 working days?
I'm not sure.
Yes.
Okay. For the AMC team, 30 working days.
From?
From the last recruitment.
We are not
The
talking
first
about
recruitment.
data cleaning, sir. We are talking about
Data
closing
cleaning.
recruitment.
No. We are just talking about the
Data cleaning 30
recruitment,
days is
cohort
fine.
formation.
Data
that-
cleaning 30 days is fine. We are talking about cohort closing.
Yeah.
Yeah. Means like once the cohort is established, the last person is recruited. After that, we are giving 30 days.
That is
to
more
clean
than
No,
the data.
Abhishek, there are
Yeah.
two things. We are talking about establishing the cohort of 750 participants. So we will require 30 working days.
To recruit the
750, yeah.
750.
Yes.
Okay. And about the data cleaning part?
Abhishek,
30 days.
fine. So Abhishek,
Yeah.
30 working days for assembling the cohort and 30 days for the cleaning. That's
Ah,
what
okay.
everybody
Yeah,
is-
so no, so we don't agree. We understand the consenting and the recruitment would take longer. So 30 working days for recruitment is perfectly fine. That is anyways 5 to 6 weeks of time. We would request you decrease the number of the days for data cleaning. That is under
That
your
we can do.
control,
That
right?
we will work out.
Yeah, so either way, it's how many?
So should I swap the numbers?
45 days.
So-
Overall 45 days.
Okay.
Yeah, you can swap.
Swap the numbers.
Yeah.
So
Dr.
15 days for
Shikha-
data
Whatever is
cleaning and
under
30
your
days for
control,
data
try to
collection.
expedite that as much as you can. And yes, there will be no compromise on quality. So no hush hush going on, Manojna. It would
Ah.
be there's no pressure that without consent you start and enroll. Nothing of that sort would happen. But try your level best to initiate as soon as possible.
Dr. Shikha, I think data cleaning, it actually depends upon how fast the JIRA queries can be answered and how fast those things can happen. So really,
How far the Jira queries are raised? That will also come into play.
Also, Dheeraj, once you give the go ahead that this is final, we have to do a pilot because he needs to look at the whatever data, how the data looks. We need to know. Then only he will be able to do the
Hey, that's
cleaning
okay.
one.
So just I need a query on the regular basis. Okay, not on the last day. Okay. So if all of the side, 11 side will send all the query on the last day, then I definitely need a time to resolve that. So if you're sending me the query on the weekly basis or something, then it will be easy for me to resolve
Rest
it.
assured, we will do
Okay.
that. We will bug you like anything.
I
Don't
take
worry.
your words. I take your
Lee.
Yes, I in the last time also.
Neeraj
we
will do it
called
the
that.
central level. When it comes to central level,
no,
then
no,
Neeraj will
really.
start asking the queries.
It's not about the central level data management. It is actually the site level data. If you want to make a change on the data, we need your approval for us to actually change the data, right? So for each of those queries, I mean, that's basically what takes time. So we can
Hey.
generate the queries, and if your
For
response is
every
quick,
edit, we need your approval.
No, not for everything. I will just share the list.
Exactly.
Okay, for which you need to say the changes which like for the screening details. There are some questions. If you want to change, then you have to report to us.
For some, not
Okay.
for all.
Not for the all. So you have full access. You
Ah.
can edit it. Okay. So yeah, in data this year.
Neeraj ji, if I am not mistaken, you said that we can edit in the web portal by ourselves and we
Yeah.
have to put a query in the Jira. That's it.
Yeah, so it was already there in the previous also.
Yes.
So in same way you have to do.
So no need of your permission, no? Only we have to put so and so we are editing.
They need for like some question, like they have some branching. Okay, suppose if you want the option to change, so there will be some other question dependent upon that. Okay, so yeah, so if you that's what we check. If suppose you have changed, if make it to no if and there is another
Okay.
questions
Okay, got it.
downline. So we also check that these are also questions for which we need the data. Okay, so then we report to the sites, kindly share this data, and once we get the data, then we just update it. And we
Okay.
say site to update it otherwise.
Okay, thank you.
Okay.
Okay, so finally we conclude that data collection will be 30 days and the site level data cleaning will take 15 days. Working days.
Okay.
Working days.
Okay.
So, but at the central level, we will need 30 days because connecting with all 10 or 11 sites will take time. So we will need 30 days to address the problems at the central level. So 30 working days. The second part is the AFI surveillance. So what we are proposing for the AFI surveillance, we can have the monthly cleaning type of thing because the process will go for 12 months, but we can just see about the data which we have gathered in 1 month, clean that data, and then central team can review it, and then we can close it up. So on a monthly basis, we can just go for that. And endline data, again, it will be a similar type of process. Uh, so will 30 days will work at the end line, 30 working days. So this will be the process, and we will try, we will also document this process and share with the sites. So there is another thing which even Dr. Shikha Malik was telling in the morning, that we should have a monthly meeting with all the sites. These should be the investigator means like driven meeting should be there. Like each site can take responsibility of one meeting every month, and it should be in the first week. Maybe we are just proposing like first Wednesday of every month, and we will see that at least one PI or a COI should join from each site, one person from each site, and share their updates and discuss their challenges. But and even we can plan for further publication plans, publication updates. So such kind of meeting if can be planned. So just look for the suggestions from the group. But I think we should go for one investigator meeting at least once a month. So I will stop and look for your comments. Dr. Naro, any comment on that? Yeah, KEM team and Rose sir, CMC team, NI team, and others like Share India, AMC team, ma'am. It will be so. Should we lock it at the first Wednesday of every month? And it will be in the means like alphabetical order, like the sites will be given the responsibility, they have to take that responsibility to organize that meeting. Those are Zoom links and other things can be shared by BIRAC if possible, or CDSA can manage, but sites can take that lead key to initiate that meeting, or they can put it some key agenda in that. So that is one thing. The second thing for the data management, as we have told, the central team has to communicate or has to connect with the sites. So we are just planning one meeting with the sites for the data management, just to clear all the doubts. If there is anything which is going wrong, or if means like there are some data queries, so it can be resolved and it can be raised at both ends, means from the central side, or it could be uh, from the sites. And like as you are telling about the Jira thing, ki it is delayed, or the process is getting delayed, so all that things can be taken up in that data monitoring. So in that we will just request if one of the investigator to be present in that meeting to listen to the data problems, because ultimately someone has to take the accountability. and data managers and other positions are definitely most invited, but investigators involvement will help us to improve the problem. So one that meeting will be planned, and that will be distributed across the month, because like we are having 11 sites to communicate, so it will be like 2 or 3 sites a week, like that we can just plan. So this is the another thing. And the third thing which we will just discuss with CDSA, like how to plan the visits, but certain visits need to be planned to the sites. What me and Neeraj were planning, like one at the initiation and one at the end, and in between, if required, the visit can be planned. But otherwise, it is not a plan. The planned visits will be in the beginning and towards the end of the study. But we are open for the suggestions, and we shall discuss with CDSA to have a joint plan for that. That will help, because if we are looking for the monitoring things, so we have to look for every aspects of the study. So anything, yeah, Dr. Manika. Ma'am. Ma'am? Okay, ma'am. Okay, yeah, yeah. Okay, Th- yeah. Sure. So these are the different communication plans. And just a brief agenda, like what we will expect in these meetings, like the study participant enrollment status, data status, misclassified status of the queries raised during last call, like Jira. So all these things can be discussed, and maybe the agenda can be modified according to the meetings, but a brief agenda, like we should focus on these points during our monthly meetings. Sorry. So also we are just developing one communication guidelines, or a communication guide. So in that we have just placed some contact points for various activities. So for the regulatory and administrative, I think BIRAC and CDSA will be the right persons to discuss about. And for the protocol and CRF, we at Incline, the medical team will be taking care. And for the EDC and IT related query, definitely the IT team at Incline will take care of that. So that is the basic contact points, but a detailed plan will be shared in due course. And presently, the team which will be focusing on this will be this one. Like we are there to take care of this from the Incline side. And as I told, that communication plan, we are just in the draft stage, and maybe it will be prepared before we initiate the study. So that's all from my end. Uh, so Dr. Rahul, any update? Should we ask for the
Couple of scenarios, real world
couple of scenario
scenarios
and their
before we wind up.
experiences?
Yeah.
So just to, I mean, it's like we have concluded with all our slides, but one part which we have left about the experiences we have gained during the field visit, and also during the last EDC session. So we can go in that way. Like as we were about to start in the morning, like group 1A can start with their experience sharing. Sorry, I'm not having that list, but if you remember the names. The first A, 1A. So if anyone of you can come on the stage and share your, yeah. So I request someone, Dr. Pooja, if you can come on the stage and share your experience.
So yesterday, our team consisted of myself from RMRC Bhubaneswar, and Saranya from PIMS, and Samuel from AMC. So as part of the Incline Somarth Palwal site visit, we visited the Gopalgarh village, So to start with, first we went to the Sarpanch of the village. We had an interaction with him. So he talked to us very well and he was quite supportive also. And after that, we started our household visits. So we interacted with one participant from the house. So she was a housewife and she was a school dropout. And she was very young and she has like two kids. One is 11 years old. So that interaction also went well. So we realized that at few points, the participant was hesitant to answer to few of our questions, which was like their caste and which kind of assets they have at their house. And yeah, that's all. So it was quite a good interaction with the participant. Then after that, we went back to the laboratory of the Somat site. So at the lab, Dr. Meenakshi and her team, they explained us the whole flow chart very well. Starting from receipt of the sample from the field, and then you check the sample transport condition, and you check the sample details, who has collected the sample, how many samples have reached the lab, and then you start with scanning the barcode of the sample tubes, and then you record all the sample details in your register, and then you move to the centrifugation process. And when you centrifuge it, you keep in mind that it has to be balanced, and then you separate the serum and make different aliquots. And then of course you put the aliquots in respective color coded boxes, which to be sent to different places. And one small point, but which is very important, Dr. Meenakshi also pointed out on putting a red tag on the AFI samples, so that visually you can distinguish whether the sample is from the baseline or the AFI sample. So both the lab and field exposure went really well for us, though we got few doubts, but it got clarified during the following sessions. So I think that's all from my side. If any other my team members have any query or concern, they can share. Thank you.
Thank you, Dr. Pooja. And uh, Suranya and Dr. Samuel, do you have any other things to add? Okay. Yeah, thank you. So just from the other village, group 5B, like it was Bharat, Venkat, and Vignesh, sorry. Yeah. So if you can share your experiences. So I will invite someone from this group. When
Good afternoon, all. I'm going to a second village, Bavigad, and my team is Venkat for Share India and another Vignesh in CMC. First, I'm going to the Sarpanch and discuss about field visit. And this well organized Sarpanch is already pre-visit information given 5 households. Then I will go to the household, and then I observe some participants is not available in this household. The observation is pre-visit is not good, I doubt, and timing is not well. Pre-visit is very important, and timing is noted down is important. Second thing is if code is lock, there is a important is house lock record. That's very important, but this is not in recorded for the build team. Then I'm going to the one household, then one respondent is available in this household, and this all information consent is information is given, but he is illiterate. Then I'm asking to any person for the impartial witness. Is a neighbor is available for educated is a fourth education, and then I mean consenting and screening part. But this is only one person is available in this household, and other three person is in this household, but this is not available at this time. Then I'm consenting and screening one participant, and I'm deciding next week same day recruiting another three participants, and then written consent is completed, and then sent back to the Sarpanch household, and practical practice for demonstration in the blood collection. It's well organized, and then return back to this site, Palwal, and Meenakshi ma'am is well presenting the all equipments, blood collection, etc. Okay, thank you.
Thank you. From the team, Group 2A, Sophie, Dr. Trivendra, and Karuna. So if anyone can give their experiences. From the team 2A, anyone is there?
Hello. Yeah, we reached Gopalgarh village yesterday. Most of the things Pooja and the other doctor have told very clearly about the Sarpanch, and later after Sarpanch behavior, he was very cooperative, and the Dr. Meenakshi part. We visited two households in Gopalgarh, and both families were very cooperative, and we consented, we talked about their consenting procedure, and there was a son of 17 years old of that lady, and it was a nuclear family, and both of the son and mother were very cooperative, and they told us about everything, and we explained about the study and overall other things, what we are doing, why we are here, what we will do in future. And in the beginning she was slightly hesitant, but later she was very cooperative, and she told us everything, and we filled there the baseline form. And again we went to the other house for the AFI surveillance form, and that was a joint family, and there was a mother-in-law, father-in-law, and one the son, basically the father, mother, and son. Son was around 50 years old, and he told us about each and everything, and we consented him, and told about the study and about the fever, and we filled there the fever, a dummy fever for surveillance form. And our overall experience was very nice. The villagers very cooperative, and Dr. Meenakshi explained in Palbal office about the blood sampling and blood procedures, and it was a totally nice experience. Thank you very much.
Thank you so much, sir. So we just wanted to know, like yesterday, a lot of people were in the team, in the field, and you might have experienced something unique, something that you want to take back as a learning to your when you go back to your sites, and something that you want to tell other people in your sites when you're training them. So, do you have? Did you ever have such experience like in the yesterday's visit? Because that will be key for us when we are doing our micro plans tomorrow. That's what we want to know. Please.
Yeah, from our team, from like Himanshu from Maulana Azad Medical College and Rajesh from CMC, Rida from Incline, and myself from Share India. We four of them went to the village called Bammadi Kheda. So there, we had a very negative experience in first house where we went. We don't know because we don't have any idea about that village. So we thought already these people, the team has explained about our visit. So we directly went and we gave one of the field supervisor or experienced person, he has explained about the study. Then we have explained about the consent, what exactly the study means. So we don't know that the how like HO, head of the family member been available. So we were discussing about the project to the relative which she is staying, because here there is some different method of culture. So we don't know what exactly the hierarchy. So we were explaining about all our the study. Then she finally said that, okay, you can go ahead. We are ready to help you. We can be staying for a whole 12 months. But finally we got information that she is a relative and she came only for few days. So we got the consent, everything. Again, we thought we were explaining about the referral part also. Like we were saying that you can, will get a treatment free of cost and all those things. But there we got a clear information, like we kept in our mind that we have our facility. So we were explaining to them. Finally, that cluster not been selected. So there we got a difference, like we should not confirmation regarding the treatment wise. We have to say only the diagnosis been referred and you can get help from our dispensary or some clinic. Whereas the treatment, it's there up to them whether they can get the treatment here or they can go outside. It's up to them. So we have clearly explained that we will be providing that treatment also. So there we had some issue and they were thinking that we are providing all the free of cost for 12 months. So this is the misconception and miscommunication to them we have provided from our team. Whereas again we have explained the same information to the head of the family person. We were waited for 10 to 15 minutes and later he came and we again explained about the study. Then we got the oral consent. This is the first experience where we got all such kind of issues and we don't want to continue in our field site. And whereas second house, we went and we got a very good response from the second house. And the person who has given the consent, he said that I am not interested to give sample, but you can take the sample from my family members. So that's how we got two different experience from two different households.
Thank you, ma'am. So basically, what I understand that we have to explain everything to the site or to the individual, the household we are approaching, because we don't know whether he is the head of the household or anyone else is the household head or anything else. Anyone else is there. We might means like give consent to take a consent from a person who is not a resident of that household. So we may end up with such problems. So the point is well taken. Any other experience from any other site?
Abhishek, just want to add what she said. She has raised very valid question, like input, because see, we require consent from the participants, but there is one more consent is needed, which is from the head of the household. So where you are going and informing that person that what is the study, what is the objective of the study, and how we are going to enroll your these many family members. So household consent is also needed. And before that, we all know, because we all go to the community, consent or information to the gatekeepers, well, like Sarpanch and all those people.
Ma'am, can we use the word sensitization for the household? Because
Sensitization.
consent to will become a confusing term.
Yeah. So maybe sensitization to the household head is very much required. So that is what she said.
Anybody else who wants to share?
So I want to just give 2 points for the maybe discussion. So the household we have visited, there were 6 members, but only 2 members were available. So it is just a suggestion before going for the consenting or enrollment. Can we make a telephonic contact or maybe home visit as per the site's feasibility, just to check all members are available, what is the feasible time them to visit. So it will really helpful for the enrollment.
So even I really like that suggestion, and we have discussed yesterday also. So like what we are practicing or we may practice. This is just a England's thought, and I will just request other sites to give a thought. Like we should send our team to sensitize the community a day prior, and so that the community can be prepared on the day of actual visit by the study team for the consenting and sample collection processes. So like we can reduce that attrition, like number of persons to be available at home. Uh, they should be aware about the visit and they should be available at that point of time, and the sites can visit. So we are actually practicing that, and maybe we can further improve on that. But what is the thought of other sites? Dr. Naro, if you can give some suggestions.
I think definitely that would help. And the other challenge I was meant to bring about, but since we're looking at the adult population as well, in our areas, there'll be lots who will not be available because they have gone out for work, because nobody's going to be just sitting for us waiting. So that part is going to be helpful. It's good that this discussion came about, because we anyway are planning, that's what we usually do. From the listing, we would give them a call and say we would come sometime. Not, yeah, because they don't really believe in that fixed appointment, but maybe today around sometime, and then that's how we normally do, and it really helps because then they're aware. So I think that's a great idea. Yes.
Thank you. Ma'am, even NI is practicing something different. Sir, if you can just give the suggestion you were giving yesterday, like early morning visits or something. Yeah.
Yeah,
Yes, sir.
actually, this is geographically different location from our area. But the here advantages is, I noticed there was no ducks. Only one lazy duck was there in the field that was sleeping. So that's a greatest advantages over this area. And in statistical terms, I have 1 success and 2 failures. So we visited 3 households. Only elders were there. So it is always expected that the elders cannot take any decision without the earning member. So that was happened yesterday. So it is mandate that we should know the availability of the participants in the village. So that is mandate. And as you said that we have to sensitize the village people that before we are going, that maybe we will visit the next day or next 2 days or 3 days. So what we will do then, we will do a community advisory board meeting at MRHRU site level, office level, with about 7 to 10 members of the key persons of the village. Then after that, maybe 2 or 3 days, we will do a sensitization meeting with the village level. So we will go to the village, we will call all the self-help group peoples who are mostly females, and then we will explain the study, and we will do all the one small video and everything. What is the advantage, disadvantage, or not disadvantage, the benefits, indirect benefits and direct benefits of the study. We knew that okay, these people are coming tomorrow to our village, they will available. So based on their availability, consenting, then we will do the complete the formalities. That is our routine practice.
Yes, sir.
But yeah, timing for us maybe the morning 6 to 8:30 to 9 o'clock. So at the time only all the participants will be available. Then after 8:30, school children will not be there. definitely those who are going for out, it depends on the seasonality and the working group, what kind of working group. So anyhow, it is better go before 8:30. That is always
Early
you know,
start can work.
yeah, yes. And one more thing, we can get rid of the hot summer also.
Dr. Hima, if you can highlight some of the key things which we have noticed. So just to share our thoughts.
Abhishek, sorry, just one more point I want to just raise. So during that visit, mostly adult population were complaining about other health issues. So they were like, okay, we will part in this, but what about other complaints? So those were their major queries. So we should be very critical in that how we counsel them, because enrollment is okay, but retention is also important. So answering their this type of queries, we should be very critical.
Definitely taken. Yesterday we had an experience like I think Bharat has already shared. So we visited a household, and within that household, there was one lady who was illiterate. We have given all the information, and then in between, we came to know that she was illiterate. So we needed a witness. So we also came to know that she was not ready to give a sample on that day. Maybe on a later date, she was ready to. She will be ready to give it, and she also wanted her husband to consent for the same process. We also thought of like if a household has more than one person who is eligible, now that we do not have a criteria of minimum and maximum, if there are more people in a household who will be possibly screened to be a part of the study, and they will be willing to consent, and there is one person who cannot give a sample, the other people want to give a sample on the same day. So there will be multiple scenarios that you will be coming across, and this requires a lot of micro planning, and along with that, not just sensitization, but your team should also be ready to take appointments prior. Go ahead uh, with the appointments in mind, and also use their line list for understanding like the education status of that family. Would you be requiring an literate witness to be present at the time of consenting to cut down the time losses? And another thing that we understood is that at field level, it was difficult for us to perform an RDT. So that's something we were able to conclude yesterday. Other than that, anybody else, if they have any suggestions?
I think the household we visited, Sharon was there along. One thing I realized that probably the females, she was not comfortable giving the information related to the female health issues and all. So I'm not sure, like, which gender distribution is required to visit. And second, when we asked about the age evidence, it was difficult for her to collect all the, while we were sitting, too difficult to collect all the Aadhaar cards and all, and
That
then
was
show
also
and bring. So
difficult,
it should
yeah.
be, I think, told upfront, and then
Huh.
because they need time, and she said it is with husband. And shouldn't you want to add something? I think that was primarily.
Yeah, that what ma'am has said, the same thing. Like she was little hesitant, and I feel the husband in this setting, husband, the head of the family, if he's there, I think we get more good data regarding the socio-demographic data, her age. She was not able to recall her date of birth as
Yeah,
when
most
we
of the
asked.
people in Pallu
So yeah.
will have that trouble. They do not recall their date of birth. Elderly. Another thing is, if you have a household like there are 4 people and 3 of them are readily available, they have given you a consent and they are ready to give the sample. They have given the sample. You have a 4th member who will be willing. They say that he will also be a part of the study, and you can come and take a consent. It would be ideal for you to go on the same day of the next week than to go on the next day, so that you cover that cluster. The whole cluster is covered on the same day every week. So that is one challenge that we have faced in the previous round of zero survey. Like for each household, we had to visit 4 times in a week for 4 different people. Any other experience?
Okay, thank you.
Okay. Thank you so much, everyone, for sharing your experiences. So just couple of quick announcements before we conclude today's the whole training program. So the expectation that we have is after all of you go back to your respective sites, you identify the local NABL labs for the testing. We've already identified Isha for chikungunya print assays. We'll soon share the information for the lab who will be performing the dengue print assays. Try to finalize your MOUs with these respective labs as early as possible. Try to get all the consumables and all the reagents that are essential to initiate the study in a really expedited manner. Our expectation is that for the next 2 weeks, after you go back, you do a pilot, and by first week of May, the study is initiated at all the sites. If you have any challenge, feel free to contact us. We are always available. Feel free to contact Inclen team. Is that okay? And CDSA team, and we'll ensure all the bottlenecks are addressed and we are able to kickstart the study. So we're just waiting for Dr. Mukherjee to join us for his concluding remarks. In the meantime, I'll just take this opportunity to thank everyone who has made this event successful. So I'll start with, on behalf of DBT and NBM BIRAC, we would like to express our heartfelt gratitude to all of you for actively participating in this 4-day intensive training program. It has been a pleasure to host you all. To start with, I would like to extend my sincere thanks to the trainers, the Inclen team under the guidance of Dr. Arora sir, and CDSA team who have contributed to the success of the whole program. Without their hard work, dedication, commitment, this event would not have been possible. Thank you so much. I would also like to thank I would also like to thank all the principal investigators and their respective teams for sharing their expertise, knowledge, and insights with the network. Your enthusiastic participation, active engagement, and valuable feedback is extremely important and have made this program all the more meaningful and memorable. I would also like to take this opportunity to thank our host, the Surya Hotel. We are immensely grateful for the excellent services and the facilities which have played a pivotal role in making this event a success. Sincere thanks to the hotel staff. Sincere thanks to Baman Lorry. So Sonia is here. And sincere thanks to the Baman Lorry team for organizing everything. Sumit and Sonia, who have accommodated our needs, making sure that everything was organized as per our requirements. Next, I would like to express my deepest gratitude to our senior management at DBT and BIRAC, who have always supported and encouraged us in formulating and organizing such programs. Thank you so much to Dr. Rajesh Kokle sir, Secretary DBT and Chairperson BIRAC, Alka ma'am, Subra sir, who's here, and Mukherjee sir for their valuable guidance, support, and leadership. Last but not the least, I would like to express my heartfelt thanks to the entire team at BIRAC. So there's a lot that happens behind the scenes, and I'm extremely grateful to the whole team for making this event a success. Thank you so much. I'll call out the names because they've worked really hard for that. Deepa, Alok, Jitendra, Rehmat from admin, Devender, who's here, Rajpreeti, Tarun, Vipul for all the IT support, Ranjay, Shailesh, Aman for all the other administrative support, and a very special thanks to Rahul, without whom this would not have been possible. Once again, thank you all for being a part of this extremely important national network and looking forward to more fruitful interactions. We hope to see you all again soon. Yeah, thank you so much. And I'll just, maybe in a couple of minutes, Dr. Mukherjee will join us, and then we'll have the final concluding remarks from him also. And we have the lunch available. I think you can start having the lunch, and when sir comes, we'll. Okay. Thank you so much, and have a safe flight, everyone back home.